Welcome to the Athlete Within Code podcast. Today I am joined by Dr. Philip Yam. So, with over 12 years of clinical practice and 12 years of service as a psychiatrist in the U.S. Navy, Dr. Philip Yam has provided evidence based treatment for thousands of individuals. Dr. Yam earned a Naval Officer Commission and completed his psychiatry residency at Walter Reed National Military Medical Center. Dr. Yam served as department head of behavioral health at the Naval Air Station Joint Reserve Base in New Orleans, Louisiana, and as head of embedded mental health at Mayport Naval Station in Jacksonville, Florida. He also served as assistant professor of psychiatry for the Uniformed Services University School of Medicine. He currently offers effective treatments like transcranial magnetic stimulation, ketamine therapy, and medication management at Serenity Mental Health. Dr. Yam, thank you so much for joining us today.
Thanks, Ashton. I'm so glad to be here.
Yes, we cannot wait to learn more. So, first off, I wanted to ask you a few questions just so that our listeners can kind of get an idea of who you are and learn a bit about you. Is that all right?
Sure, go ahead.
All right. The first one is, do you feel like there are any misconceptions or stigmas around the field of psychiatry? And if so, what are some of those?
Yeah, it takes a lot of courage to ask for help, and that's pretty much the hardest step. So when you're asking about stigma, psychiatry, there's different cultural takes on mental health. People come from different backgrounds where they may not even talk about mental health. Their culture or their families may not be something that they even think about. It may not be an option for them. Um, there's also a lot of stigma around being on medications and going to therapy. It's like, well, why are you doing that? Is something wrong with your mind? And there's not. Anyone who needs help, anyone could need help and have struggles, and it's a very very good thing to get help.
Yeah, that's super insightful. Thank you for sharing that. Would you say is the most rewarding part of your job?
I have so much enjoyment helping people every day. Um, People come in here and they're very vulnerable, and if I can speak with them and interact with them and provide that care and provide them hope with a treatment plan and then get to know them and see them get better, that is the most rewarding thing that I do.
Yeah, that's amazing. Just like having the passion for it, I feel like really is what takes you far in it. What is your favorite thing about living in Florida?
Florida, it's got to be the weather. You really can't beat it. Right now, the summer is pretty brutal, but when it's hot, get in the pool, go to the beach. There's no excuse for it. In the wintertime, that's the best time to be in Florida. It's perfect here.
Yes, perfect year-round weather. What is your favorite sport that you've played?
I played a couple sports. I started playing basketball when I was younger with all my friends, and then later in high school, I started playing some soccer and really enjoyed the team aspect of it.
Nice. That's awesome. And what is your favorite sport to watch?
Definitely NFL football. There's a lot of NFL and sports in Florida. I grew up in Tennessee, supporting the Volunteers in Tennessee, and then now here in Jacksonville, we unfortunately have the Jacksonville Jaguars who've had a hard time, but they're good every now and then.
Yeah, definitely like something to do and something to be involved in. What
Definitely.
is a favorite activity to do as a family?
Family, anything outdoors. We love getting on bikes, scooters, throwing the softball in the backyard, water gun fights, traveling, you name it. You could do a staycation in Florida. There's always somewhere to discover nearby, or go up the coast, or go down the coast. Um, yeah, we stay very active.
Love that. That's a great answer. And I read online that you really enjoy traveling. So, where is your favorite place that you've traveled to before?
Good question, Ashton. Been around the states quite a bit, in Canada, the Caribbean. I think the most amazing place I've been to is Japan. Just an incredible culture, the history, the industry, the hardworking nature, and just the cities there are incredible, and also the food, obviously.
Oh, I'm sure. Is there like a specific city that comes to mind, like stands out?
Uh, Definitely Tokyo. And what's nice is once you're in Tokyo, you can easily take the bullet train right over. It goes like 100 to 120 miles an hour. It's extremely amazing. And in 3 hours, you're in Osaka, um, in Kyoto, which was the old capital. So there's a lot of architecture, a lot of temples, and just to see the countryside while going extremely fast, it's quite an experience. It's not like just looking at a plane. You're down there on the ground, but moving so quickly.
Wow, that's amazing. Tokyo Marathon is, like, on my bucket list of things to do one day, so I'll have to let you know if I ever make it there. All right. Well, thank you so much for answering our brief intro. I kind of try and do that with most of our guests that we have on and just kind of give our listeners an idea of who our guest is. But now that we're kind of getting into it, I want to start out in your intro. I was talking about TMS, which is transcranial magnetic
Stimulation.
stimulation. So, if you would kind of tell our listeners and inform me, what is TMS?
Yeah, so the field of psychiatry is always evolving. We've come a long way. I'm kind of stealing this from the Carlat podcast, but one thing that Dr. Aiken mentioned on it was that we're kind of in the third field or third tier of psychiatry right now. It started off with psychotherapy, Sigmund Freud, talking on a couch, and that was how it ran for a long time. Then in the 80s and 90s, we got into medication, psychopharmacology, up into the 2000s. Take your Prozac, take your Adderall, Xanax, find a pill to treat that. And we're still there. We still use therapy. We still use medication. But now we're entering in a new phase which I call neuroplasticity, and so finding ways to actually intervene with your brain and improve your brain health, your neural connections, try to reset them rather than just medicate. Definitely take advantage of all the treatments that have been out there, but now people that have been in treatment with therapy or medication, and doing different treatments and programs, and if they're not doing better, should consider interventional program. TMS has been around since the 80s, and it was initially invented to kind of like diagnose neurological problems, like motor problems in the brain, like stroke or MS, Parkinson's, and they were looking for ways to stimulate the inside of the brain, and they came up with using magnetic fields. And if you move something magnetic around any kind of electrical component, including the brain, it will set off electricity in that component without touching it necessarily, just through magnetic pulses. And so they were able to move your hands and your feet for you using this device, this technology, and it was safe and non-painful. So over time, those subjects that were trying this device to diagnose more like the neurological problems that they had, they were feeling better. They were noticing, well, my stroke symptoms are actually improving even after you're testing this thing. And so they came up with an idea, well, let's try other areas of the brain like the frontal lobe, the prefrontal cortex. Can we help someone with anxiety? Can we help someone with depression? Can we help someone with ADHD without a medication? And fast forward 40 years plus, and here we are. And now it's been FDA approved in the United States since 2008. So we're going on 20 years now of TMS in the US. And it's used all over the world now as a interventional treatment for mental health conditions.
That is amazing and so fascinating, like, the way that you described it, like, I really feel like I can picture kind of how it's working, inside the brain, different parts of the brain, and I wanna talk a little bit about how it is commonly known to treat, like, medication-resistant depression and OCD is, like, some of the things that I found out. How have you seen that, like, apply in real life, or have you, like, witnessed that?
Absolutely. I've helped hundreds of patients in the last 3 years since I've been with Serenity. Um, you wouldn't believe how many people have come back and said, "This is the best I've ever felt." I've been getting help for 20 years. I've been on medications. I've been getting treatments, and nothing's worked like this before. Um, it's really profound. I have patients that blow me away. Like they do better than I thought they would, and I'm just so impressed since I've been in this field for over 10 years, and to see them change like that, it really makes it even more rewarding for me. Kind of more like in the studies, they did a study. It came out in late 2024 with a meta-analysis of 10,000 patients over many, many years and many, many studies and study programs. And they were looking at what was called, like you said, treatment-resistant depression, meaning defined as they've been on at least two medications and not responded and still suffering from symptoms. And they looked at what did they do next after failing two antidepressants and how effective was that next step. And they were very broad with the study. They looked at medications, they looked at antidepressants, sleeping medications, antipsychotics, anxiety pills, thyroid hormone, and then alternative things like psilocybin and ayahuasca and ECT, TMS and ketamine were in there. So they were interested to see like what did they do, and what was interesting, they looked at all of these responses that people had tried, and they put them in order from top to bottom of what was the most responsive and what was the least responsive in order. And what was interesting about this study is that the top half of the most responding treatments were alternative treatments. There were things that you don't normally think you're going to talk to your psychiatrist about. There was things like uh, transcranial direct current stimulation, which is just the scalpel treatment that they can do to stimulate it. There was TMS and ketamine was towards the top, near the very top. Psilocybin and ayahuasca were up there. And if you looked at the bottom half of the list, that's where you saw things that you normally do think you might talk to your psychiatrist about. Things like Prozac, Seroquel, lamotrigine, Lamictal, mood stabilizers, antipsychotics, Abilify. Not to downplay the importance of medications and how they've helped so many people, but that study just showed me we need to move into other options and give people that need help, especially with treatment-resistant depression.
Yeah, for sure. And I think you're so right. It is kind of this like limited scope, or it has been for so long, with, people coming in and right away getting on SSRIs, getting on, different antidepressants, different mood stabilizers. And so I think it is really cool, especially now with like, social media and just media in general. I feel like it is kind of becoming more aware in these different fields. People are becoming more aware of it. Do you feel like media has kind of like helped portray it maybe as something that's not as daunting or not as, scary to some people?
Absolutely. We've only just I think over the past 10, 20 years, the stigma for seeking help has decreased a lot. A lot of famous people, celebrities, athletes, have come out and just admitted that they get help for mental health, and I think that's a wonderful thing, because if someone that's famous, they can say that it's okay for them to get help, then if you're just someone out there living your normal life and you're struggling, and they're willing to ask for it, then someone like that might be willing to get help.
Yeah, vulnerability is so powerful for sure. I kind of want to go into how maybe you think that TMS could be effective for athletes, specifically concussions and different like TBIs. I know, football, it's so common. Really, any sport nowadays, I feel like it's becoming more common, especially in contact sports. So, kind of tell us a little bit about how like neuroplasticity and the resilience that the brain has, and how TMS could be helpful for coming back off of recovery from concussions.
Absolutely. Athletes are just like any of us, right? They're human. They experience stress. They experience any medical conditions or mental health conditions. They can have depression. They can suffer from anxiety, trauma, PTSD, ADHD, bipolar disorder. And what's difficult is if they do get help and they get put on a medication, there can be side effects. They might have to take it long term. They might become reliant on it to manage their lives and to manage their symptoms, especially if they're having like a lot of anxiety. Um, And then if they're experiencing side effects and on and off these medications, that can cause brain fog, that can cause weight gain, affect their motivation, and they need all that to be peak athletes. So when we're talking about non-invasive treatments like TMS, then we could actually improve those symptoms, get rid of their anxiety. And I've seen many people literally have no anxiety after TMS, which is just incredible. And to not rely on taking Prozac or Zoloft every day for the next 2 or 3 years, to have an option like that, to give that to people, it's really inspiring. So that would be a good benefit when it comes to concussions, TBI. I mean, we're right on the money there, right? People with chronic traumatic brain injury, they suffer from a lot of depression, memory loss, headaches, migraines, vision loss, hearing loss, ringing in the ears. Uh, and if you're an athlete, you're exposed to a lot of head injuries, or you can be. So if you do something like TMS, it actually regenerates the inside of the brain and resets those neural pathways to become healthy again, to reconnect the bridge. Sometimes I think of TMS as if there's nerves that were used to talk and they're not talking anymore, if you have a medication, you might be able to jump over that bridge like a booster pack, like a little rocket jump to make it across that bridge so that thought, that plan gets executed. But if we can try TMS, we actually don't just jump over the bridge, the broken bridge. We repair the bridge so that thought can get through without the medication, or maybe even if they're on medication, to help that medication work, because that's where the medications are trying to work, is those synapses in the brain, those mental connections.
Yeah, that's such a good metaphor you just said, like, instead of, kind of putting something over it or, like, a temporary Band-Aid just to make it through, it really is kind of healing it from the inside out, which I think is really cool. I had 3 concussions throughout college volleyball, so I'm sitting here listening to this like, maybe I need to, come try it sometime, but kind of tell our listeners, maybe let's say like I was coming to you or someone was coming to you for the first time interested in this, maybe how you would approach that or what a first initial session would kind of look like with you.
Sure. We've got about 35 Serenity clinics nationwide in large metropolitan areas. It includes, and we include just a complete evaluation on a psychiatric evaluation for ADHD, anxiety, depression. So we're taking patients, and we'd be glad to see anybody that wants to come in. So what that'll look like is get established, you get a referral through your primary care, or someone could just call us directly, and we could schedule an appointment directly. We would take all major insurances, and you'd come in. We have a beautiful office at every single office. I'm looking at a huge lake right now. There's an alligator out in the water.
Wow.
We have birds flying everywhere. So every Serenity has a nice atmosphere. We try to live up to the name of Serenity, and we'll just provide a full comprehensive evaluation, come up with a plan to help any mental health condition that people are seeking treatment for, whether it's ADHD, anxiety, depression, bipolar, OCD, PTSD, and others, and provide that guidance. And if they might come in, they might just need to talk to somebody. That's perfectly okay. I wouldn't prevent anyone or want anyone to not just be heard and get that empathy and that support, and then we'll follow it up, and see how else we can help. If they want to start a medication, we definitely prescribe all psychiatric medications here and provide management for that. And if they want to step up to upgrade to the full treatments, either early on or maybe later on, whenever they feel like they're ready. We provide ketamine infusions just for 6 sessions over 2 weeks, and then if we provide TMS, that'll take about 2 months to complete.
Okay. Talk a little bit about like the ketamine infusions. Tell us about that.
Absolutely. So ketamine has been around a long time. It's a drug. It's a drug of abuse. So to be cautious if you're going to consider ketamine. I wouldn't recommend it outside of a medical setting. Um, it's an anesthetic. And so you know how we're all talking about psychedelics nowadays with mental health, with depression, mushrooms, psilocybin, and MDMA for PTSD. There's all these studies right now, but doctors can't write them yet. We can't prescribe those things outside of a research institution or a study. So, but what are these psychedelics trying to do? How do they work? Why are people taking them? Why are people microdosing them for depression and anxiety? They're doing it to induce chemical neuroplasticity in the brain, trying to reset nerves away from anxiety, away from panic attacks, away from depression, and towards a healthy brain. Doctors can't write these though yet because they can harm somebody. They could do damage to somebody that could worsen their bipolar, worsen their psychosis, or induce psychosis or hallucinations and paranoia. That's not good for anybody. I wouldn't want to do that to anybody and have their parent come in and say, "Oh my gosh, you caused my kid to have psychosis." That would be a horrible thing. So until we're there, we're not going to be using psychedelics in a medical setting. Maybe in the future, I hope we could continue to improve these molecules and make them safe. But ketamine, like you asked, can induce that neuroplasticity without as much of the risk of the psychosis. It can in very rare conditions, but this is not a psychedelic. It's a dissociative anesthetic, and it's used for surgery. So you could have surgery with ketamine, and that's at a really high dose. What's interesting though is that high dose doesn't necessarily improve mental health. Interesting enough, what they found up at Yale in the 2000s was if you lower the dose of ketamine and you keep someone awake and they have like about an hour and a half of a dissociative experience, it's a little bit of out of body feeling, can be a little jarring, can be relaxing. It's just a different experience for some people, but they can have remission of depression or anxiety symptoms within 24 hours. It's just so rapid and so effective. And so what we do here is we will provide that 6 times over 2 weeks and really ramp up their improvement, and then and then we'll find new ways to maintain that benefit, good habits, lifestyle changes, therapy, medication, or even starting TMS along with it to take that benefit long term. We don't really do long term ketamine here. Some places do. We just feel like we like to take advantage of it and of its neuroplasticity, and then find ways to keep that benefit long term.
That is so interesting to hear about. And even, you saying neuroplasticity, I think a lot of people that experience, PTSD or any trauma throughout life, I think sometimes there's this, this thought of my brain is going to be this way forever, and these thoughts are going to, sit with me for the rest of my life. So it is really, interesting and intriguing to hear about these different kind of, alternative options to really kind of like rewire, those pathways in the brain and get to a point where maybe those things aren't affecting people as much as they once were. So that's really interesting. And that kind of goes into the next thing I wanted to talk about. You've worked with PTSD specifically, within the military population a lot. And I would like you to kind of just unpack PTSD, maybe just share, your experience with it, what you know about it, and how it can affect and impact individuals.
PTSD is a really horrible condition, and it really affects so many people. I think it affects more people than we know. It's very common, and it happens after obviously a traumatic event. Post-traumatic stress disorder is the full name of PTSD, and it kind of starts as what we call an acute stress disorder when something traumatic happens, and then if it lasts more than 30 days and it's still causing recurring memories, distressful thoughts, personality changes, cognitive changes about the world, about oneself, about people, and then also having those classic symptoms of nightmares, flashbacks of the trauma. If that goes on beyond 30 days, then that's going to be a clinical diagnosis of PTSD. And so yes, I worked with lots of people in the military that have experienced combat, experienced trauma in wartime events, and also unfortunately sexual trauma and that type of trauma as well. And so recovering from PTSD is very hard. It's a long journey. It's a long pathway. And still, the best treatment of PTSD is still psychotherapy, right? If we use medications, it helps with the symptoms, but recovering from trauma and redeveloping, reprocessing all that is done through psychotherapy, trauma-based psychotherapy, a therapy called EMDR, eye movement, reprocessing, and whenever someone goes through that, it can be hard because it is what it sounds like. It's exposure to those memories and then trying to reprocess them. So what that means for an individual going through treatment is it could actually get a little worse before it gets better, but that's kind of part of the journey. So you really wouldn't want to start that until someone is stable enough to handle that type of treatment. So sometimes someone who wants to get better with PTSD, they need a little time with their therapist to be ready to start that trauma therapy.
Yeah, for sure. And it's kind of like another example, like you were saying earlier, like, putting a band-aid on something versus actually, really getting into it and working through it. And like you said, it might, get worse before it gets better. That could probably, be scary for some people. And they might think like, okay, I need to stop. Like this is getting worse. But really it's like those hard things are gonna happen first before you start to see the effects. And it's funny that you mentioned EMDR, the eye movement desensitization and reprocessing, because I've been learning a lot about that and how it is proven to be effective in PTSD. And kind of like anyone who hasn't really heard of EMDR, it is like the bilateral stimulation. So you're sitting down with someone. Usually there's like a moving light or someone moving their finger, and it kind of taps into these two sides of your brain where you are reliving those experiences, and those memories are very vivid in someone's mind. So it does kind of trigger those memories back, and like you said, could cause someone to feel like they're getting worse before getting better. So how have you kind of seen TMS maybe be different than EMDR when it comes to the PTSD recovery?
Sure, and I'll also mention ketamine as well. I guess if I started with the ketamine, ketamine has a way of going deep into the brain, into those deeper emotional trauma areas. I would call it the kind of below the cingulate gyrus. It's called the subgenual cortex. It's a little deep in there, neuroanatomy wise, but that's where a lot of grief, a lot of sadness, and trauma kind of lingers long term. And when you use treatment with ketamine, it can go in and kind of rewire some of those areas. Not to lose someone's grief. Grief is still grief. Grief is hard, but to try to balance out the communication down there, to have the grief exist, but not feel so sad, so defeated about it, and just when grief, when it takes over your entire brain, you can't move forward at all. And then for TMS, similarly, also sending signals through the prefrontal cortex. When you stimulate the prefrontal cortex, the executive area of the brain, it connects deeper to the deeper parts of the brain. Some of the older primal parts of the brain, like the brainstem, the limbic system, the amygdala, the hippocampus, and it can help regulate those flaring areas that were causing recurring panic attacks, intrusive thoughts, memories, flashbacks, right? So if you improve the frontal lobe, you can regulate and balance out those deeper areas that are really out of control, and that's kind of why the patients are coming in to see us, trying to get help recontrol their brain, and that's how the TMS works.
Wow, thanks for sharing that. That's so informative and really neat to hear about. You work a lot with, depression, anxiety, bipolar disorder, and ADHD amongst, many others. How have you seen these diagnoses increase throughout today's generations, and what do you think are some contributing factors maybe to the increasing rates of these?
Yeah, good question. As we've gone along, like we said, the stigma has decreased, which is a good thing, but the supply of mental health has slowly improved, but not kept up to the rate of the demand for mental health. We also had a bit of a pandemic there, which really exacerbated a lot of people's lives through just direct loss of loved ones, through social isolation, losing jobs, financial status, and then for the younger people and the newer generations, impacting their school time, their time with peers, time being with their teachers, being around each other. So when we did that, people missed graduations and proms and football games and everything that's needed to get through the gauntlet of growing up, which is already hard enough as it is. So losing that social connectedness and that ability to feel safe around other people, socialize, and then have that support around others, that isolation is not good for mental health, right? And and then adding on the social media growth that's happened, really we just connect through electronics nowadays, and that's not ideal when we're social creatures,
Yeah.
right? We do so much more together in our society and civilization, and our brains, our minds improve, when we talk to each other and are around, connect with each other. So all those things combined has definitely spiked the demand for mental health. So we need more therapists, we need more nurse practitioners, psychiatric nurse practitioners. We need more psychiatrists. Uh, we especially in areas of like rural areas and other small areas that really only have a one therapist for many miles, or one primary care doctor managing psychiatric medications. So we've seen a lot of demand come up.
Yeah, for sure. And even, telehealth is becoming a lot bigger, which I mean, there are benefits to it. It can reach people where, there might not be as much access and, different states, you can overlap with the licensure. But like you were saying, we are social creatures. So it definitely is different for, a telehealth experience, talking one on one with someone versus really being in person with someone, getting to have that interaction. So yeah, thank you for touching on that.
Absolutely. I wouldn't um, go hard on telehealth. I think it's an important asset of what we do at where we work at Serenity. It is all in person. We're old school, but in person is still the best. But telehealth has its benefits. It's very convenient. People are busy. Traveling is hard. I'd rather someone do telehealth or do teletherapy than nothing at all.
Yeah.
So if that's the best for them, if that's what works for them, I think that's a great opportunity.
For sure, definitely. And I kinda wanna zoom out and backtrack a little bit. You've been in the clinical practice for over, 12 years, been involved in numerous careers involving, psychiatry. Tell us about kind of why you first had this desire to enter this career, enter this field, and how you have arrived at your decision to work with TMS and where you are now.
Yeah, well, when I started studying medicine, I had other ideas, other plans, but plans change. I was interested in radiology, I was interested in emergency medicine, and when I first stepped into an ER, I said, this is not my place. Some people, that's where they want to be. That's where they feel the calling, and that is perfect. But that wasn't for me. And then when I rotated in radiology, I was there watching radiographs all day, and I just felt like I really couldn't stay. That wouldn't be my place either. So there's in these fields, there's something for everybody. So that I think that's why it's important to rotate around and kind of find your calling. When I rotated on psychiatry, I met a young man who had developed psychotic thoughts, and I've never really talked to anyone with psychosis before. And he was diagnosed with schizoaffective disorder, which causes psychosis, mood disorder, mania, depression. And he was getting better with medication on an inpatient setting. And every day while rotating, I talked to this young man, and I was just fascinated. And so that's when I realized that I think with all the scientific growth and knowledge in psychiatry and mental health and all the changes, we really don't even know that much. We're learning so much about it all the time. And I thought that opportunity, in addition to the variety of ages, and different conditions and different parts of life, because mental health can affect anyone from being a kid to middle age to old age. So having that variety was appealing to me. And then fast forward, I did join the military, and I served as a psychiatrist for 12 years in the military, and I got out. When I got out, I rotated on all kinds of levels of psychiatric practices: outpatient, inpatient, geriatric, consult psychiatry, military, at sea psychiatry, war psychiatry. And what I hadn't done, though, is had a lot of experience with interventional psychiatry. And so I thought, as a way to keep my interest up, to keep my neuroplasticity going, to learn more, even after my career, would be to move towards interventional and try some additional treatments. And so once I got to Serenity, I trained with them to become an interventional psychiatrist with TMS and ketamine, and to continue my other therapies as well as medication management. So I just felt like it was a good way to go a different direction, and then also see what else I could do for my patients. And
Wow,
it's been working.
I love hearing like that story and, even you thinking maybe you kind of wanted to go one way and then experiencing it and, kind of turning towards something else. I feel like that's so common in so many people after college, in general, thinking that, maybe one career is something that you want and then kind of pivoting and finding what you really feel called to. So thanks for sharing that story with us. That's awesome.
Absolutely.
Making an impact every day with what you're doing now. That's amazing. We are getting a little bit close to time, so usually I wrap up with the same question I ask every guest, and it is, what advice would you give your younger self?
I thought you'd ask that. So I would say to my younger self, just be yourself. Don't try to control how everyone thinks about you. Um, if you come to a situation where you think you were embarrassed or were nervous or couldn't be yourself, just reset your mind. Just tell yourself that people are busy. There's a lot going on. There's a lot of drama, and people are stressed out and have a lot of things to do today. They're probably not thinking about you.
Yeah.
So why are you thinking about them? And I think that would help anybody who's trying to just be themselves, meet people, and just explore the world.
Such a good answer. That's probably like one of my favorite parts of this podcast is hearing everyone's different answer to that same question. And so many people, talk about how, the older they get, the more experiences they have, just really kind of letting go of the thoughts of other people and, not allowing those to dictate what you're doing in your life. So that's really helpful advice for sure. And something that even I'm still learning, every single day, every year. So yeah, thank you so much, Dr. Young, for coming on today, for taking time out just to come inform me and inform our listeners and audience about all of the work that you're doing. It's so cool to hear about, super insightful. And yeah, it's what you guys do is so cool. So thank you so much.
Absolutely. Thanks, Ashton, for having me.
Of course. We'll see you next time.
Okay. Thank you.
You're welcome.